This animation is a presentation of the findings from a 3-month feasibility study investigating stillbirth. The study was carried out in Murtala Muhammed Specialist Hospital, Kano, funded by the Global Challenges Research Fund. Demographic and health data on mothers were collected alongside data on the birth and delivery outcome. Samples for lab analysis and photographs were taken to aid stillbirth classification. Nearly all of the world's stillbirths occur in low and middle income countries, and Nigeria accounts for 12% of all stillbirths globally. For about half of stillbirths, intrauterine fetal death occurs during the intrapartum period, rendering these deaths potentially preventable. We recruited 1,926 mothers who delivered 1,998 neonates between October 2018 and January 2019. 1,789 or 90% were live births, and 209 or 10% were stillbirths, equating to a stillbirth rate of 105 in 1,000 births, or 1 in every 10 births being a stillbirth. With approximately 25 deliveries daily in Murtala Muhammed Specialist Hospital, this is the equivalent of 2 to 3 deliveries, resulting in stillbirth every day. Using the photographs, we identified 52% as potentially related to death during the intrapartum period. The majority of participants were aged between 24 and 30. An increase in mother's age was associated with stillbirth. The majority of the mothers who had a stillbirth had no formal education. If primary school was the highest educational attainment, the odds of her having a stillbirth were over 3 times higher compared to those educated to secondary school level. Almost half of the participants lived in a house. Living in a shack represented the smallest percentage of mothers. Yet, of those, 19% had a stillbirth. The odds of a stillbirth for those living in a shack was more than double than those living in an apartment or house. Overall, 37% of mothers reported having more than 5 previous pregnancies, known as grand multiparity. Of these mothers, 56% had a stillbirth. Our findings identified that grand multiparity more than doubled the odds of stillbirth when compared to mothers who had less than 5 previous pregnancies. If the mother had had a previous stillbirth, the odds of a subsequent stillbirth were almost 3 times higher. The odds of stillbirth among mothers with hypertension was almost double. The majority of participants lived within 10 kilometers of hospital, though some lived over 100 kilometers away. The odds of delivering a stillbirth were higher as the distance between home and hospital increased. 31% of mothers had a pit latrine in their home, and when compared to a flushing toilet, a pit latrine was associated with 3 times higher odds of stillbirth. Only 19% of participants had access to water via municipal network. Accessing water through any other means was also associated with almost double the odds of stillbirth. 40% of participants took folic acid or iron supplements during pregnancy, and this was associated with lower odds of stillbirth. Once adjusting for demographic, living environment, mother's medical and pregnancy history, the following factors were associated with higher odds of stillbirth. Mother's highest level of education being primary school education or below versus secondary school education or above. Living more than 10 kilometers from hospital versus less than 10 kilometers. Living in a shack versus house or apartment. Maternal hypertension, and previous pregnancy resulting in stillbirth. These data were produced following a small feasibility study, yet show the extent to which stillbirths occur in MMSH and the features associated with stillbirth. There are many successful stillbirth interventions available, and using these data to inform appropriate intervention selection is a measured approach to take. The variable focusing on distance between home and hospital may highlight the need for the development of community care centers with trained midwives who can identify high-risk mothers and pregnancies. Having little or no education was strongly associated with stillbirth, suggesting the need for a health literacy intervention in this setting. Lastly, identifying women who previously had a stillbirth is a useful first step in understanding the complexities during pregnancies and delivery, as well as provide extra antenatal care and support to these women.